everyone. So some of you know that I'm a doctor here in Hawaii, but many of you might not know is that I actually trained in New York City and was a resident at New York University's Bellevue Hospital. And that is the basis for the new medical drama, New Amsterdam. New Amsterdam, New York used to be called New Amsterdam. It's supposed to follow a guy, I think, that's the medical director of the largest or oldest public hospital in the country, which is what Bellevue was. So not a big leap to get from New Amsterdam to Bellevue Hospital. And I was just looking through my account, finding something to binge watch, and I saw that one of the episodes was a Blackout episode. And I actually lived through the Blackout of 2003 in New York City, where the entire Eastern Seaboard had no power, I think for like 24 or 48 hours, I can't remember exactly. But I was a Bellevue resident at the time. So I thought I would watch this and see how much of it is accurate. I'm an ophthalmologist, of course. I don't do ER medicine or heart surgery or anything else, but maybe I can weigh in on some things. Keep watching.
Max,
we lost power.
shouldn't the generator be coming
Wait a
on?
second.
What's happening?
Sorry, folks. It appears we lost power, but the generator should be kicking in shortly.
Is everyone all right? My baby's cold. Can I get a blanket?
All right, everybody, bundle up.
My husband couldn't get here for her birth and we've been discharged. The insurance company wouldn't let us stay. Okay, here, just take my coat and I'll get you a blanket as soon as possible.
Okay, so the power just went out and like all of a sudden it's cold. There is a backup generator at all of the hospitals, and shutting off the heat doesn't instantly make it cold 12 seconds later, so that's a little funny.
Is the heat coming back on?
Yeah, shortly.
Come on in, guys. Just head right over here. We're gonna fix this.
Max,
Yeah.
follow me. The generator should have kicked in by now. The circulatory machines, the ventilators.
Okay, just do a quick status run, check out the wards, and I'll meet you in the ED.
No, someone else.
I'm fine. You wanted to tell me something.
It can wait.
Side note, so I've never watched this show before, as I mentioned, so it seems like this character, the doctor, is dating, I don't know, is he a doctor? Is he a patient? I'm not sure. Something's going on. And that happens a lot when you're in the hospital. You tend to date other people that are in the hospital. My husband and I met during our residency. We were both working at Bellevue Hospital. So I can relate to this. That's pretty on point there.
Henry,
Dr. Goodwin,
how many on maintenance tonight?
you're looking at him.
Why isn't the generator coming
I'm
on?
on my way to find out, but it looks like the entire lower Manhattan grid is down.
Every minute we're without power.
So that is what happened in New York during the Blackout of 2003. It was actually not just lower Manhattan, but the entire city, the Eastern Seaboard, I think Philadelphia, a lot of cities in the Northeast had no power for 24 hours. So this is pretty appropriate, but I was not running through the basement halls looking for a generator or the electrical panel or whatever it is. It was actually summer, so it was super, super hot, which was the opposite. Nobody had air conditioning. And unlike the heat, when you don't have air conditioning right away, you get really, 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 really hot right away. So, yes.
Ordering.
But you still have me, right?
Oh yeah. Hold him front.
Reynolds?
It's all good, Dr. Sharp. I'm holding his heart together with my fingers. But without power, we got no cardiopulmonary bypass.
No way to titrate anesthesia.
We can't operate without him.
Max is working on the generator. How are you doing, sir?
Well, you know.
Can I get another micro-certificate? On it.
So this is obviously a life-saving surgery. When we had the blackout, all of the elective surgeries were obviously canceled because we can't do anything. without anesthesia and lights and all our monitors and even the electronic medical record. Everything is on based on electricity. But this guy's got something going on with his heart, I think, and they obviously have to just make do and figure it out, MacGyver style, I'm imagining. We'll see.
Take a few deep breaths for me, okay, buddy?
Deep breaths?
We're all in this together, all right? Burrow.
Iggy,
Yeah.
it's midnight. Why wasn't this scheduled for earlier?
We only bring the prisoners at night, ma'am, for everyone's sake.
Can you handle this?
Now that is true. As a Bellevue resident, I took care of a lot of Rikers Island prisoners. I recognized that orange jumpsuit right away. And they do always bring the prisoners at night. It is to decrease the incidence of breakouts and that kind of thing. And they would bring them all the time at like between midnight and 4 in the morning for an event that happened even 24 hours prior. So a lot of times the prisoners would get into fights, either with other prisoners or with guards. They would get punched in the face and get a fracture of their eye. And then we would be called in the middle of the night to come see them, even if it happened during the day, because they were trying to minimize the chance that they might organize a breakout. So that part is true. And we did take care of a lot of Rikers Island prisoners. Also true.
I want to get to the ED. I'll be there in a minute.
I'll tell you one thing, I would never go in Bellevue Hospital. And I used to work there before they renovated it, and it's really nice and fancy now. I worked there when it was really old and super scary. And if I heard a noise in an elevator, I would not be going there. Don't they watch horror movies?
Hello?
Helen?
VJ?
Yes. I'm here with Dr. Hartman.
You know my name's Clint, right?
Side note, VJ is my brother's name. And it's an Indian doctor, finally. All these medical dramas, very few Indian people, and we have lots of Indian doctors in America. I like seeing an Indian doctor.
Generator.
Not unless you can fix it.
Guys, I may know someone who can.
Who?
Well, he's currently stuck in an MRI machine.
The Rikers patient.
Yes, the Rikers patient. But he used to work for DWP. He's smart.
Okay, great.
Yeah. Full disclosure, though, he sort of murdered his coworker.
Oh my God.
Right, but it wasn't premeditated. He's not a psychopath. He just has behavioral issues.
Rather big one, don't you think?
Yeah. I'll take full responsibility. Plus, there's a guard there, so it's our best shot.
Rikers Island prisoners always come with 2 guards, FYI. At least they did back in the day when I used to take care of them. And especially someone convicted of murder would certainly have at least 2 guards, not just 1.
Agnes! I'll hold her. She was complaining of a headache earlier.
Want me to get Dr. Kapoor?
He's stuck in an elevator. With Hartman. You're gonna have to take care of him.
It's all right, Dr. Sharp. I've got her.
And this is a side note. I was actually a medical student during 9/11, and there is just something about New Yorkers that will pull together in a crisis situation, and that, I don't know, that really touched me to see the older lady patient grabbing the baby.
Who are your maintenance people?
All but one were sent home and he's hurt.
Hurt trying to do the job you want me to do.
Afraid so.
Is this your idea?
Not remotely.
I'm gonna need a set of plans.
For the generator?
For the hospital.
Prisoners usually would be shackled both wrists and ankles when they were seeing us as patients. Maybe this different situation because now they trust him to actually figure out how to fix this electrical circuit board. So he's got to have his hands free at some point, I guess.
I'm going to tell the story of how, in the worst blizzard New York's seen in a century, we were trapped in a hospital, and it can be a story about how tired and hungry and cold and angry we were. It can be a story about how we couldn't stop fighting with each other, or how Dr. Sharp kept yelling at you. Or it can be a story of how when every instinct told us to be at our worst, we were at our best. And if we do that, then maybe Hugh gets to stick around and tell that story too. So, would anyone like a blood test?
Yeah, I will.
Yes?
Yeah, me
Thank you.
too.
Yeah, great, thanks.
Uh-huh.
You just see Casey right here, and he'll help you out. Thank you.
We walk blind, we try to see, falling behind and what could be. Bring me a higher love. Bring me a higher love. Bring me a...
So I know this part of the TV show is supposed to tug on your heartstrings with everyone volunteering to donate blood. But again, not during the blackout, but when I was a med student right after 9/11, my roommate and I went to go volunteer the following day at the blood center, which was 2 blocks from our med student housing at Cornell. And the line was literally, I mean, it was just blocks long for people wanting to donate, because at the time they thought that there were going to be a lot more survivors than they were. And so again, I do think that New Yorkers pull together in times of crisis like this. And I actually could see this completely happening.
We have to choose who to let go.
I can't. Choose. I won't.
Then I will.
The city's still out.
That needs a generator. I don't see what me not triaging patients has to do with us.
I can't be your friend and your doctor and your deputy, so I have to choose. I have to triage us. I'm going to ask Dr. Staunton to take over from me. She's an exceptional oncologist.
No, you don't.
She'll be your new Dr. Max. She'll handle your care effective immediately.
Oh, what if I want you?
I'm afraid that's no longer an option. Because we all want you.
So that makes me very nostalgic for New York, the final scene with the beautiful skyline and snow. I don't get any snow here in Hawaii. I guess I figured out by the end she was both his doctor and his friend, and it seems like subordinate, which I was my husband's chief resident, so we had that relationship that was quite similar, but in a different situation, and obviously ours worked out. I'm not sure if theirs is going to work out or not, but it does happen a lot of residents dating each other, a lot of interns, nurses, doctors, all of that. And it's very difficult to manage a lot of times because there's such an intersection of work and life when you're a resident. It's just you live and breathe in the hospital, and it's really hard to get perspective. So I don't know, might be a show I keep watching. Thanks for joining me.